I am just going to have a very quick talk today about a little bit about the biomechanics of the foot. I was asking some of my other teachers where they felt as Pilates teachers they maybe lacked a little bit of knowledge, and I think in general we get the basics of the foot but not the whole sort of story in terms of the mechanics of the bones. So I have got a lovely foot here that moves, so we are going to bring this foot down and I'm going to talk you through some of the basic mechanics of the foot, and if Zoe can make sure we get a good view of the foot, we don't need to see me in this. So we've got lots of important bones in our feet, and most of us are familiar with the calcaneus, which is our heel bone, and I think one of the really nice cool things to look at is that that heel bone actually doesn't sit central on the foot. So I know when we talk about a tripod in the foot, we think of the middle of the foot, but actually the bit to the side of the calcaneus is a back pad. So we want to be just slightly to the lateral side of that heel in normal stance. And then we want the even distribution between the underneath the big toe and the little toe, or the metatarsals. So when we are standing and walking, and when we're looking at feet in general, we have different bones that influence things. We've got the calcaneus, and then underneath that we've got the talus, and we've got the tibia, which continues to go up, and we've got the fibula, which also goes up, and then we've got all these little bones in the foot which all work intricately together to help us with gait. We've got the navicular, and we've got the cuboid, and then we've got our cuneiforms with our metatarsals coming up. And I think one of the things to think about and to talk about is that in gait cycle, out of the phases of gait, there's only one where you actually need to pronate. So in pronation of the foot, we are talking about the forefoot moving to look away. So as we pronate, we go into a bit of eversion of the heel. So the heel starts to look, here we go here, starts to look out, and the foot flattens, and ideally in pronation the joints on the inside of the foot are opening and the joints on the outside of the foot are closing down. And then as we come out of pronation, we come into a bit of supination. We have inversion of the heel. So if you think about the heel or the foot looking in towards the center line, then that's your inversion. And that is where we stand, and that is where we push off in gait, and that is most of our gait is in that position. I think one of the things that we have to be really aware about is when we take people from that position to that position, that the toes should always remain on the ground. So the toes actually move about in the coronal plane, and they move around in the sagittal plane, and they should always be on the ground. So when you're doing footwork or any kind of foot exercises with your clients, try not to let the big toe or the little come up, because really these bones should be working around allowing those down. When we get stiffness in the midfoot is when we start to see toes lift off and things, because we haven't got the appropriate movements. One of the other things that I think is interesting, so in terms of, it's a timing mechanism of the movements of the foot. I'm not going into all of it because it's way too complicated to do in this video, but the big bone on the outside, which is called the cuboid, the two metatarsals, so the fourth and the fifth metatarsal, really link into that, and they work in opposition to the other three, which is what creates the arches under the feet. So these two bones will respond to what that little bone is doing in your normal foot mechanics. And then we've got more going on through here.
Pam Steele is waving to say hello.
Okay, well, hello Pam, it's great that you're watching. So what I'm going to do now, so that's a very, very small look at sort of the movements that the foot should make. Just to put this in perspective and to give you something that you can try at home right away, I've got Teresa here, and she's a set of feet, and I'm going to have her stand. And there are lots of assessments in Pilates therapy we give you. One of the things you can look at and do right now with your clients, though, is to have them stand. And I'm not even going to assess or work or worry too much about where she is now, but I'm going to have her rotate all the way around to the right, leaving her feet right there. She's just going to rotate. In good foot mechanics, you will find that the side that they're turning to, the leg that's rotating out into lateral rotation, you will go into a supinated foot, which Teresa has done, but her toes come off the ground. So we know there's some stiffness going on there. And the other ankle should go into pronation, and that is normal movement for the feet. And if she rotates around the other way, then we should have the same thing. So you can, again, she doesn't want to keep those big toes down. So we would be looking at maybe stiffness in her midfoot here somewhere. Or the fact that maybe, come back for me, Teresa, she hasn't got the ability to move her cuboid and fourth and fifth metatarsal. But you can all go back to your clients today or look in the mirror, and you can rotate to the right and you can rotate to the left, and you'll be surprised at how many people don't move their feet at all, which isn't great, because your feet and your talus influence your tibia, the influences your femur and up the chain, because it's like the song, and one bone connects to the next bone and the other bone. And if you found this interesting at all, we've got a foot and knee mechanic course coming up soon in Ferndown, or we also have them in London and Oxford, and we will cover lots of screens, but we look very much more in depth at the mechanics of the foot and then things that you can do to help them gain those movements back. So thank you for listening. It's Bonnie Southgate from Pilates Therapy.
And hello, Julie Ingram.
And hello to Julie Ingram. Nice to hear from you.